Hi, I'm Dr. Vasanth Kumar, a COVID specialist in the world, positive to negative in just 4 days. It is unbelievable and no one can imagine that one. Second is the dengue, where the platelets increase in just 12 to 24 hours. In all my cases, which I have treated till now, in thousands. Whereas dengue and chikungunya, there won't be any joint pains. It will be subsided in just 4 to 5 days in all my cases. How it is possible? Various medicines are there and available. That medicines will kill the virus, so there won't be any problem. Today we see two people, one group of people. One is Siddaramaiah, Chief Minister of Karnataka, saying that the vaccine is killing the people in Hassan district. 23 people died. 23 sudden cardiac arrest, heart attacks in a span of just 30 to 40 days. Earlier in 2 years, since 2 years, there are 507 cases of sudden cardiac arrest. He is claiming that vaccine is the reason. The counterpart, the left side, which is ICMR, AIMS, Biocon, Serum Institute of India, Poonawalla, and etc., all pharma companies and vaccine companies saying that it is not with the vaccine. Then who is the killer? Who is the killer here? You just imagine. The people are we. Just listening to both of them. Then who is the killer? One is saying the vaccine is not the killing agent. Other is saying the vaccine is the killing agent. So why the people are dying? If the ICMR is good, IAMS is saying that it is not with the vaccine. What is the cause then? It's a virus. Let me come with some type of things. The AstraZeneca Covishield vaccine, prepared, manufactured, and invented by the Oxford University, England, Britain. They had given single dose to their country people. After that, they noticed that it is having the side effects and it has been thrown in the dustbin. They requested all the European nations to give the same vaccine AstraZeneca to all the people, but Germany, France, Italy, and all those countries just rejected that one. Listen to this one clearly. Rejected. Then this vaccine has been introduced in India by Poonawalla, well-known manufacturing from India, Pune. So he has given the first dose to the doctors, especially the warriors, because so many people died till now with what we do. But still, they say it is not the vaccine. The vaccine which has been given 1, 2, 3 doses in India. Recently, after 2.5 to 3 years with the fighting with the Supreme Court, the case has been admitted against the AstraZeneca Covishield in the UK, where they won, and the UK Supreme Court has ordered the AstraZeneca to give the compensation to those people. Nearly 81 people has filed this one, some all with the comorbidities and having the injuries or death and everything. In India, after that, a girl, almost 20 years old girl, as father has filed a case in the Supreme Court, but it is not admitted at all. They did not take this case. After fighting here and there, then they admitted the case. Just the ICMR says it is not with the COVID vaccine. Then who is killer here? So many people, almost 10% excess of deaths in India and all over the world. 10% excess deaths. It is not a simple joke. Even the birth rate has decreased from 2.1 to 1.9. You can imagine that there are a lot of miscarriage and abortions too. Here, the topic is the vaccine. What is that vaccine? They say that any complication if you give a vaccine to a person, the complication arises within 21 days or in 1 month. Fine, that's good. Yes, everyone felt that they did have the fever and all other body pains and all the things. They did not see the heart. They did not go through the heart what is happening in the heart. They did not go through those clotting system like D-dimer increased or not. But it has happened. Myocarditis. The word myocarditis indicates the inflammation of the heart, the damage to the heart wall and the blood vessels there. The pericarditis, the sheet covering the heart is the pericarditis that is involved, and that again inflammation because of the viral particles and the spike protein, not this spike protein. This spike protein, which has caused the inflammation in the heart, has damaged there. Who has taken the vaccine? Well, suppose if nothing has happened, it's good. You continue your life with normal things with a sort of damage there, with little bit of damage or maximum damage. But what happens when Siddaramaiah, like person saying that this vaccine has damaged the things and that is causing the heart attacks, like epidemic, 23 people die in a span of 1 month, and still going. Deaths have been continuous since 2 years. What could be the cause then? I feel that Siddaramaiah point of version is just like 50% in that one. What about the ICMR? A big body. Research is the word in that one. Indian Council of Medical Research. What the research they are doing there? Did they see any sort of things like a sudden fall? Not the chest pain of heart attacks traditional, which was earlier, but this is different. It is a syncopal like fall and the death, the person. I've seen the cases in Telangana, 2 deaths in my area itself in just a span of 1 week. And other person I could listen that with a brain stroke. It's happening because of the COVID. The COVID has been there for a long time. It has been there. It is going to be there. It is not today. Tomorrow it's going to be there. Yes. It causes a fever, just a body pains, weakness, and all the things for 1 day or 1 week. But still, the virus will be staying in your body for a long time. It has a habit of damaging the heart, myocarditis, pericarditis. It has the habit of the unique only feature of the COVID is the clot forming, the D-dimer level increase. Though not in all the persons, but those persons who has the what you call the liver problems and all other connective tissue disorders. So clots, thrombosis, thrombocytopenia syndrome, which has been a specific syndrome. Everyone knows that thrombosis is just the clot. Thrombocytopenia is the platelets, decrease in the platelets, and that causes the embolic way, thromboembolism, and the strokes and heart attacks. This is what one is Siddaramaiah sir, 50%. The other is the COVID from my side. It is the killer of these people in those areas. Well, these people again will say there is no COVID. There is no treatment. There is a treatment. I had given with the proofs to the ICMR. I had given with the proofs everything to the ICMR, Union Health Minister. Still, twice I had given, but no response from them because they don't want to give the medicine to you. You can see here a unit of people, all the people that have been in the papers right now, news, they are unity at one place because they had given the vaccine. And they could able to stop the medicine. On the other side, some people, the poor people, the victims of this everything is the poor people because most of the politicians, they did not have the vaccine at all. Like our KCR and so many people. That's it. Covishield is a vaccine given to only the doctors. Frontline warriors like police people and other people like municipality and all the things. These are the frontline workers has been experimental with this Covishield vaccine. But all the politicians, if they had taken some vaccine, might be the Covaxin later on they had taken, not the Covishield. It is harsh to anything because we the taxpayers, we are paying the tax to all the Indians paying the tax to ICMR, AIMS, and all these research people and those people who have been in the medical college and hospital, they have been given the salary of the pocket of at the rate of the taxes from the people. If you don't want to give, it is very harsh. It is very harsh. I don't know where the intelligence department is. I had held so many press meets, and even as speaking, I'm talking to all the media too. But still, the intelligence department don't care such things. Even if some terrorist comes to India, they don't even see that until they blast anything. This is what happening in India. I request the people to share this video to everyone so that it should be an awareness. If a small viral infection that can be treatable with a medicine available with Vasanth protocol only, my treatment protocol kills the virus. Habit of killing the virus. So I request any sort of thing that could be tested immediately so that the people can save. These two people fighting for what? The common man. Common man is dying. Will die. If you don't share, they will die. Going on killing, dying. If I say that killing, it's not good. At the end of the day, both are the friends. But you people, you common people, never get a good treatment, never get a good vaccine. Then, if you survive, also at some time, you'll have the chest pain and you'll be visiting to the cardiologist, where the cardiologist will again milk out your money. Relax. A simple medicines that removes the virus, that kills the virus, that prevents the myocarditis, that prevents the pericarditis, that removes the clots. If the D-dimer level is that indicates the clots, that is removes that one and makes the liver coming to normal within a week. So this is the only unique treatment in this world. You can't escape from my thing. That is what I want to say. It is up to you. If you feel these two people are the gods, then everything will be, then you people will become whatever you want. I request all the people to share this video. This video should reach to the Siddhiramaya too and most eminent persons too. Thank you.